According to the American Diabetes Association, diabetes is a disease that affects 23.6 million people in the United States today. Diabetes is the inability of a body to produce or properly use a hormone called insulin. Insulin is produced by cells called beta cells in the pancreas. It is responsible for converting starches, sugars, and other foods into a form of energy that is vital in performing a body's normal functions. In the following speech, I will discuss the significance of learning about this disease and why it is so valuable to me. This is my 16-year-old brother, Michael. He was diagnosed with type 1 diabetes in March of 2008 at age 15. He became very sick suddenly, and as we have no history of diabetes in our family, his diagnosis was extremely shocking. While diabetes is something that can be controlled through careful monitoring, it is definitely a very life-altering disease. Each item of food or drink that my brother now consumes must be inspected as to how many carbohydrates it contains, and each carbohydrate must be compensated for with insulin injections. The normal teenage boy eats tons and tons of food all day long. My brother, however, cannot live this normal life and has had to adjust to this more demanding way to live. There are two main divisions of this disease. In type 1 diabetes, the body no longer produces the insulin needed to allow glucose to fuel a person's cells. The more commonly witnessed form, type 2 diabetes, occurs when a body is unable to properly use the insulin it is able to make. The reasons in which both type 1 and type 2 diabetes occur remain a mystery today, even with the advanced technology this world has. Researchers have ideas as to the general process of this disease's development, but are still not able to identify the true cause or understand the pattern for who develops diabetes. There is still not enough knowledge to determine who develops type 1 other than the significant pattern of diabetes that travels down family trees. Type 2 diabetes, however, is different in that generally healthy foods, exercise, and maintaining a healthy weight can manage this type of diabetes. The only way to really learn about and conquer this disease is through research and unfaltering dedication. There are many research programs that are desperately seeking to answer many people's questions of why did this happen and what can I do to stop this. I was recently given the opportunity to attend a research program called JDRF Day at UF. JDRF stands for the Juvenile Diabetes Research Foundation. The University of Florida presented their top researchers and scientists to discuss where the future cure and prevention of diabetes stands today. Ideas such as pancreas transplants have been researched extensively as a cure for diabetes. However, this procedure would cause the patient to have a need to be on autoimmune depressants for the rest of their lives. This would make them very susceptible to any illness and require them to take a lot of medications on a daily basis. So this idea has been ruled out as not too much of an improvement for the lives of diabetics. A man named Dr. Edward Scott discussed the most promising idea being researched today. This idea, while believed to prevent and someday cure diabetes, is also a very controversial topic in today's society. Stem cell research is an idea that is heard very often on news programs today. As Dr. Scott described, stem cells are believed to be able to recreate the beta cells of the pancreas and even allow the pancreas to start making insulin once again. The problem with the advancement of this research is that many people who may not fully understand this process believe that this is a form of playing God and it is not our right to pursue this. There are special concerns about the use of embryonic stem cells, which doctors believe would be the best cells to use in this therapy. While the debate about the ethics of this research continues, scientists are working hard in order to make a process like this feasible and to give diabetics the freedom back that they once had. Diabetes is a serious disease that affects almost everyone. Even if you do not have diabetes, most people know someone, either a family member or friend, who has experienced the difficult lifestyle of diabetes. The reason I chose to speak on this topic is because, like many others whose lives have been affected by this disease, I am trying very hard to do my part in helping the research efforts. As an older sister, it is hard for me to watch my little brother struggle with this. That is why I hope I can make a true difference someday in the fight against diabetes. The only way researchers and scientists will ever be able to stop this disease from affecting many people's lives is by gaining more information and by relying on the help and support of all people. Whether you have diabetes or don't, have a family history of it or not, scientists need help gathering data from you. They are working hard to look at the DNA of diabetics versus the DNA of non-diabetics, in hopes that they can find some kind of link that will solve this difficult mystery. If you have a history of diabetes, it is vital to continually be tested because it is believed that the sooner the disease is caught, the better chance it may one day be cured. The other side of the research process that needs support is the financial side. When I visited the University of Florida's research facilities, I was shown all of the very specialized and highly technological machines that are necessary to studying diabetes. Without the generous donations from people worldwide, programs such as UF's would not be able to exist. As I conclude this speech, I plead with you to become involved in this hopefully life-changing effort. Give a blood sample to a diabetes research program and know that every person worldwide struggling with this disease right now may again one day live free, all thanks to your support. And here's my audience. Thank you.